Walking into a doctor's office for your first gynecologist visit can feel intimidating, mysterious, or even a little scary. But it doesn't have to be. Understanding what to expect can help you feel more confident, empowered, and ready to take charge of your health. This guide is designed especially for young women and girls who are preparing for their first appointment with a gynecologist. Whether you're going because you've reached a certain age, have specific questions, or are experiencing symptoms you want to discuss. First, let's talk about why you might be visiting a gynecologist in the first place. Gynecologists are doctors who specialize in women's reproductive health, which means they are experts in everything related to your period, ovaries, uterus, breasts, and more. It's generally recommended that girls make their first visit between the ages of 13 and 15, or when they start having questions or concerns about their bodies or periods. Your first visit doesn't necessarily mean you'll have a pelvic exam. Often, it's simply a conversation to establish a relationship with your doctor and to answer any questions you have. When you arrive at the doctor's office, you'll be greeted at the front desk, asked to sign in, and likely fill out some forms. These forms might ask about your medical history, whether you've had any surgeries or illnesses, what medications you take, and about your family's medical history. It's okay if you don't know all the answers. Just do your best, and don't be afraid to ask a parent or guardian for help. You'll also be asked about your periods, when you had your first one, how regular they are, how heavy or painful they are, and any other symptoms you experience. Once you're called back to the exam room, a nurse or medical assistant will usually check your height, weight, blood pressure, and possibly your temperature. These are basic health checks that help your doctor get an overall sense of your health. You might be asked to change into a gown, or you may remain in your own clothes, depending on what the doctor plans to do during the visit. Now, you'll meet the gynecologist. This doctor could be a woman or a man, and if you have a preference, it's okay to ask for a doctor you feel comfortable with. If you're nervous about being alone, you can usually ask to have a parent, guardian, or another adult with you in the room. Some girls find it helpful to bring a list of questions or concerns. They can be about anything from periods to puberty, sex, birth control, or even body image. Your doctor will likely start the visit by talking to you. They'll ask about your health, your period, any pain or discomfort you've experienced, and any questions or worries you have. Remember, gynecologists are trained to talk about all sorts of personal topics, and nothing you ask will shock them. This is a safe space, and you can speak honestly and openly. For most girls, the first visit does not include a pelvic exam, especially if you're under 21 and not experiencing any problems. Instead, the focus is on talking, education, and answering your questions. If you're having problems like severe menstrual cramps, heavy periods, or unusual discharge, your doctor may recommend an exam, but they will always explain what's happening and why. If a pelvic exam is necessary, your doctor will walk you through every step. A pelvic exam usually involves 3 parts: an external exam, an internal exam, and sometimes a pap smear. The external exam is simply a visual check of your vulva, the outside of your genital area, to look for any rashes, irritation, or signs of infection. If an internal exam is needed, you'll be asked to lie back with your feet in stirrups. The doctor will use a tool called a speculum to gently open the vagina so they can see the cervix, the opening to the uterus. This might feel a bit strange or uncomfortable, but it shouldn't be painful. If you ever feel pain, let your doctor know. They can stop at any time. A pap smear, which is a test for cervical cancer, is not usually done until you're 21, unless you have specific symptoms or risk factors. If you do have a pap smear, the doctor will use a small brush to collect a few cells from your cervix. The entire process takes just a few moments. Sometimes your doctor may also do a bimanual exam, where the surgeon gently insert 1 or 2 gloved fingers into the vagina while pressing on your abdomen with the other hand. This helps them check the size and position of your uterus and ovaries. Again, this can feel a bit strange, but shouldn't hurt. After the physical part of the exam, you'll have time to talk more with your doctor. They may discuss topics like menstrual health, safe sex, birth control options, the HPV vaccine, or anything else related to your reproductive health. This is a good time to ask questions, even ones that feel embarrassing. Your gynecologist has heard it all before, and they're there to help you, not judge you. If you're sexually active, your gynecologist might recommend tests for sexually transmitted infections, STIs, which can often be done with a urine sample or a simple swab. You can talk to your doctor about your sexual activity in confidence. What you share is private, and your doctor will keep it confidential, except in cases where someone is in danger. After your visit, you might feel relieved, proud, or even surprised at how straightforward the experience was. Remember, taking care of your reproductive health is a normal part of growing up, just like visiting the dentist or the eye doctor. Regular visits with your gynecologist will help you stay healthy, answer your questions as your body changes, and give you the information and support you need to make informed decisions about your health. Above all, remember that this is your body and your health. You have the right to ask questions, say no to anything that makes you uncomfortable, and choose a doctor who respects you. Bringing a trusted adult or friend, making a list of questions, and being honest about your concerns can help you make the most of your first visit. The first gynecologist visit is an important step in taking care of yourself. It's about building a relationship with a doctor who will support you through all the changes of adolescence and adulthood. The more you know, the more confident and empowered you'll feel. So, take a deep breath, know that you're not alone, and remember that you're doing something good for your health and your future.